What is going on, gangers? Brother Nandi back at your service, and I'm here to dive into a new series where we look at fictional characters and what health conditions they may have. If you'd like to stay caught up with this series, please make sure you subscribe to my channel. So, for part 2 of this series, we are going to dive into a fictional character that people may or may not know, and her name is Ruri from Dr. Stone. I decided to use pneumonia to describe Ruri's illness. But let's give y'all some context about pneumonia. Pneumonia is basically an infection caused by organisms that will bring water into the lungs and it will make it difficult to breathe. The organisms will either originate through viruses or bacteria. But hold on, I'm not even done yet because pneumonia is categorized with particular types. We have community acquired pneumonia, where someone would get pneumonia outside of the hospital or healthcare, and we have hospital acquired pneumonia. Obviously, that would mean you're getting it in the hospital. And with hospital acquired pneumonia, that would prove to be more lethal because your immune system is already weakened, and now you're contracting something else. And lastly, we have ventilator associated pneumonia, where someone's contracting pneumonia through a ventilator. If we tie this back to Ruri from Dr. Stone, I believe she has community acquired pneumonia because back then they didn't have any hospitals or whatnot, and I think she just developed it through being in the world. Now let's dive into the symptoms of pneumonia. The ones that I thought were important to highlight were dyspnea, which is shortness of breath, chest pain, productive cough, could either be yellow sputum, which is pus, or bloody sputum, which obviously would be red. And then we also have things like fever and fatigue. Now, if you do watch Dr. Stone and saw Ruri, she was coughing up blood, so checkmate on that. She had fatigue, and she had shortness of breath. And in real life terms, the way we would be able to diagnose something like this would be a chest x-ray. But obviously in Dr. Stone, they are deprived of those type of resources. But shout out to my boy Senku for trying to diagnose Ruri. That's a big shout out to him. But if you did not have access to a chest x-ray, you could listen to their lung sounds, and if you hear things like crackles, that is a good indication that they may have pneumonia. Now, how in God's name do you treat pneumonia? I think it depends on the severity of the pneumonia. But first line of defense, you'll probably use antibiotics. Now, in Dr. Stone, they actually use sulfa drugs, and that could be proven to work. But in this day and age, we usually use things like amoxicillin, penicillin first. But sulfa drugs is not a bad answer as well. You also could use cough suppressants and pain medication like Tylenol and ibuprofen. Now, how can we prevent pneumonia? I'll tell you how. First thing I would say, vaccination. We have what we call PCV, that's for short terms. This is what we give little kids to prevent pneumonia. You can also get it as an older adult. One that's very easy and that people take for granted, practicing good hygiene, washing your hands, sneezing on your elbows, all those things. Avoiding crowded places in a sense. Again, like I said, we're using this series to highlight a multitude of health conditions so that people will be aware. And we're using fictional characters so that people could have a different perspective on what they're seeing. If something is wrong, always seek help. Remember that. If y'all enjoyed this video, please like, comment, and subscribe to my channel. This is part 2 of the series, so don't forget to check out part 1 if you missed it. And if you want suggestions for part 3, just leave them in the comments. Take it easy, guys.